He went to bed that night feeling completely fine. No pain, no fear, no reason to worry. He spoke to his family, followed his normal routine, and lay down to sleep just like every other night. There were no dramatic warning signs, no cries for help, no visible signal that anything was wrong. By morning, he was gone. His family believed it was peaceful, quiet, gentle. They thought his body had simply rested and never awakened, but the truth was far more disturbing. Inside his body, a silent and dangerous cascade had already begun. His blood flow had started to change. His heart was under hidden stress. His brain was slowly being deprived of the oxygen it desperately needed. And the most shocking part is this. The trigger didn't begin during sleep. It started hours before he ever closed his eyes. Small, invisible changes had already set the process in motion, changes that most people ignore, changes that feel harmless, changes that millions of people experience every single night without realizing the deadly risk they may be creating. I'm going to show you exactly what happened inside his body and how to make sure it never happens to you. Most people believe that dying in sleep means dying peacefully. It sounds gentle. It sounds safe. After all, sleep is supposed to be the body's time to rest, recover, and heal. But medically, this belief is dangerously incomplete. Sleep is not a shutdown. Your heart does not turn off. Your brain does not pause. In fact, some of the most critical and unstable changes in your entire 24-hour cycle happen while you are asleep. Your nervous system shifts, your blood pressure fluctuates, your hormone levels rise and fall in precise patterns. Your blood itself changes thickness and clotting tendency depending on the time of night. And the most dangerous period comes just before you wake up. According to the American Heart Association and the World Health Organization, the early morning hours, especially between 4 a.m. and 10 a.m., are when the risk of heart attacks and strokes rises sharply. This happens because your body is preparing to wake. Stress hormones like cortisol surge, your blood pressure rises rapidly, your heart begins working harder to push blood through vessels that may already be narrowed or stiff with age. At the same time, your blood becomes more prone to clotting. This combination creates a perfect storm. If a clot forms, it can block blood flow to the heart, or it can travel to the brain. Oxygen supply stops, cells begin to die, and because the person is asleep, there is no movement, no call for help, and no immediate response. What appears peaceful on the outside can actually be a sudden internal crisis. Night is not passive. Night is dynamic. And for vulnerable individuals, night can be the most dangerous battleground their heart and brain face all day. At around 3 a.m., your body enters one of the most complex and unstable phases of the entire night. You may look completely still on the outside, but inside, your brain and cardiovascular system are incredibly active. This is the period when you spend more time in REM sleep, rapid eye movement sleep. This is the stage where dreams occur. Your brain becomes highly stimulated, almost as active as when you are awake. But unlike daytime wakefulness, your body is not fully prepared to stabilize the sudden changes that REM sleep creates. During REM sleep, your nervous system shifts rapidly between calm and alert states. Your heart rate may suddenly speed up, then slow down again. Your blood pressure may rise unexpectedly, then drop moments later. These fluctuations place stress on blood vessels, especially in older adults where arteries may already be stiff or narrowed. At the same time, your breathing becomes more irregular. Instead of steady, predictable breaths, your breathing may become shallow, uneven, or briefly pause. These tiny interruptions can reduce the amount of oxygen entering your bloodstream. Even small drops in oxygen force your heart to work harder, pushing faster and stronger to supply your brain with what it needs. Inside your blood vessels, oxygen levels may dip just enough to create silent strain on sensitive tissues. Your brain immediately detects this imbalance and responds by activating protective mechanisms. One of the most powerful responses is the release of adrenaline, the same hormone your body releases during fear or stress. But during sleep, these adrenaline releases are called microsurges. They are small, brief, often unnoticed, but their effects are real. Adrenaline causes your heart to beat faster. It causes your blood vessels to tighten. It raises your blood pressure suddenly. These rapid changes can destabilize vulnerable plaques inside arteries. If a plaque ruptures, your body immediately tries to repair it by forming a clot. That clot can grow within minutes. If it blocks an artery supplying your heart, a heart attack begins silently. If it blocks an artery supplying your brain, a stroke begins silently. And because you're asleep, you feel nothing. No warning, no pain strong enough to wake you in time. This is why the early morning hours, especially around 3 a.m., are one of the most physiologically unstable periods for the cardiovascular system. Your brain is highly active, your breathing is less predictable, your oxygen levels fluctuate, your blood pressure rises and falls, and adrenaline surges through your system in brief, powerful waves. For a healthy, resilient body, these changes are usually tolerated, but for an aging heart, or narrowed arteries, or thickened blood, this period can quietly become the moment when everything changes. Now we need to talk about one of the most underestimated dangers of the night: overnight oxygen drops. Most people think breathing during sleep is automatic and stable, but for millions of adults, especially over 50, that is not true. During sleep, the muscles that keep your airway open naturally relax. In some people, especially those with extra neck tissue, a smaller jaw structure, or age-related muscle weakening, the airway can partially or completely collapse. This condition is known as sleep apnea. When the airway collapses, airflow stops. You may not wake up consciously, you may not remember anything in the morning, but inside your body, oxygen levels begin to fall silently. Within seconds, the oxygen saturation in your blood drops. Your brain detects this as an emergency. To protect you, it triggers a powerful survival response. Adrenaline floods your system. Your heart rate surges. Your blood vessels clamp down. Your blood pressure can spike by 30 to 60 millimeters of mercury in just seconds. Imagine your pressure jumping from normal to dangerously high almost instantly. This is not a gentle change. It is a shock to the cardiovascular system. And here's the frightening part. This doesn't happen once. In moderate to severe sleep apnea, it can repeat dozens of times per hour. Every collapse, every oxygen drop, every adrenaline surge, over and over, all night long. Your body is not resting, it is fighting for air. Each surge increases strain on the heart muscle. Each pressure spike stresses the inner lining of your arteries. Over time, this promotes inflammation, plaque instability, and higher clot risk. The repeated oxygen drops also make your blood more prone to clotting. The combination of thicker blood, vessel stress, and pressure spikes create the exact environment where heart attacks and strokes are more likely to occur, especially in the early morning hours. And the most dangerous part? Most people never know they have it. They don't wake up gasping dramatically. They may only feel mild fatigue, maybe morning headaches, maybe high blood pressure that seems hard to control. Sometimes the only sign is loud snoring that a partner notices. But inside the body, night after night, silent oxygen deprivation and adrenaline surges are placing enormous strain on the heart and brain. Sleep apnea is not just about snoring. It is a powerful cardiovascular stress disorder that works quietly in the dark when you believe you are safest. Around 4 a.m., your body begins a critical transition. Even though your eyes are still closed and you feel asleep, internally, your system is preparing to wake. Your brain activates a powerful biological signal designed to help you become alert, focused, and ready for the day. This signal is the release of cortisol. Cortisol is often called the alertness hormone. It is produced by your adrenal glands and follows a precise daily rhythm. During the late night, cortisol remains low, but in the early morning hours, especially between 4 a.m. and 6 a.m., cortisol levels begin to rise sharply. This sudden increase is not gentle. It is a powerful activation signal that affects your entire cardiovascular system. As cortisol rises, your blood pressure begins to climb. Your heart starts pumping harder and faster. Your blood vessels tighten slightly to maintain circulation as your body prepares to move from rest to activity. At the same time, another dangerous change begins to occur. Your blood becomes more prone to clotting. This is a natural protective mechanism. Your body is preparing for the physical activity of the day ahead, reducing the risk of bleeding if injury occurs. But in aging adults or those with narrowed arteries, this protective mechanism can become a hidden threat. Because if there is already plaque inside an artery, a buildup of fat, cholesterol, and inflammatory material, the sudden rise in pressure can destabilize it. Plaques are not solid like rock. Many are fragile. They have thin outer caps that can rupture under stress. When blood pressure surges rapidly, it increases the mechanical force against artery walls. If a vulnerable plaque ruptures, your body immediately treats it like an injury. It forms a clot. This clot can grow within minutes. If it blocks a coronary artery, blood flow to part of the heart stops. A heart attack begins. If it blocks an artery supplying the brain, oxygen delivery stops. A stroke begins. This entire process can happen silently, without enough warning to wake a person in time. This is why the early morning hours are known in medicine as one of the most vulnerable windows for cardiovascular events. Your hormones are shifting, your blood pressure is rising, your blood is more likely to clot, and your arteries are under sudden stress after hours of relative calm. The moment your body is preparing to wake can also be the moment of greatest danger. There is another silent change that happens every single night, and almost no one thinks about it. Your blood becomes thicker. From the moment you fall asleep, your body goes for 7 to 8 hours without fluid intake. You are not drinking water. You are still losing small amounts of fluid through breathing, through your skin, and through normal metabolic processes. This gradual fluid loss reduces the liquid portion of your blood, known as plasma. When plasma volume drops, the remaining components of blood, red blood cells, platelets, and clotting proteins, become more concentrated, which means thicker and slower flowing. Thicker blood does not move as easily through narrow vessels. Your heart must work harder to push it forward. Your circulation becomes less efficient, and in areas where arteries are already partially narrowed, blood flow can slow down even further. Slow-moving, thicker blood creates the perfect environment for clot formation. Clotting proteins are now more concentrated, platelets are more likely to stick together, and if there is even a small, unstable plaque inside a vessel, thicker blood makes it easier for a clot to form and grow rapidly. Alcohol makes this risk significantly worse. Many people believe alcohol helps them sleep better, but alcohol is a powerful dehydrating agent. It causes your body to lose more fluid through increased urine production. This accelerates the drop in plasma volume overnight, making the blood even thicker by early morning. By the time you reach the vulnerable window between 4 a.m. and 10 a.m., your blood may be at its thickest point of the entire day. Your heart is pumping harder, your blood pressure is rising, your blood is thicker, and your clotting tendency is higher. This combination creates a dangerous situation, because thicker blood not only makes it harder for your heart to circulate oxygen, it also makes it much easier for a life-threatening clot to form silently, without warning, while you are still asleep. Most people believe a heart attack happens because an artery slowly becomes more and more blocked over time until blood can no longer pass through. But that is not what usually causes the sudden fatal event. The real danger is not just the blockage. The real danger is rupture. Inside your arteries, plaque can build silently for decades. This plaque is made of cholesterol, inflammatory cells, calcium, and fatty deposits. It attaches to the inner wall of the artery and slowly grows over time. You may feel completely normal while this is happening. No pain, no warning, no obvious symptoms. Many plaques do not fully block the artery. Some may only narrow it by 30%, 40%, or 50%. Blood can still pass through. The person may never suspect anything is wrong. But the most dangerous plaques are not always the biggest ones. They are the most unstable ones. These unstable plaques often have a thin, fragile outer covering. They are like a small blister on the inside of your artery wall. They may sit quietly for years without causing problems, but under sudden stress, they can tear open. And this is where the real danger begins. During the early morning hours, when blood pressure rises sharply, the force of blood pushing against artery walls increases. This sudden pressure spike can tear the thin surface of an unstable plaque. The moment it tears, your body reacts instantly. It believes an injury has occurred inside the blood vessel. Your emergency clotting system activates within seconds. Platelets rush to the site. Clotting proteins begin forming a seal. A blood clot starts growing rapidly over the rupture. But inside a narrow artery, this protective response becomes deadly. Instead of healing the vessel, the clot can grow large enough to completely block blood flow. When blood flow stops, oxygen can no longer reach the heart muscle. Heart cells are extremely sensitive to oxygen deprivation. Within minutes, those cells begin to weaken. Then they begin to die. This is the moment a heart attack begins. And according to the American College of Cardiology, the severity of damage depends on how quickly blood flow is restored. But during sleep, there is no movement, no immediate call for help, no rapid treatment. The blockage remains. The heart muscle continues to die silently. And what started as a tiny tear in a fragile plaque becomes a life-ending event before morning arrives. Now here is where the real danger emerges. Not from one single factor, but from everything combining together in the same night. Think about a typical evening that millions of people experience every day. Dinner happens late. The meal is heavy, rich, and difficult to digest. Your body must now redirect energy and blood flow toward digestion instead of recovery. Your heart continues working harder even though you believe you are resting. Then comes alcohol. It may feel relaxing at first. It may make you feel sleepy. But inside your body, alcohol begins dehydrating you. Fluid leaves your bloodstream. Your blood slowly becomes thicker. Your heart must now push harder to circulate it. As the night continues, dehydration quietly worsens. Your plasma volume drops. Your circulation slows. Your blood becomes more concentrated and more prone to clotting. The environment around you also plays a role. A warm room may feel comfortable, but excessive warmth can slightly lower oxygen efficiency and place additional stress on your cardiovascular system. Your body must work harder to regulate temperature while maintaining stable circulation. At the same time, many people are still using their phones before bed. The artificial blue light suppresses melatonin, the hormone responsible for stabilizing your sleep cycle and protecting your cardiovascular system during rest. Without proper melatonin signaling, sleep becomes more unstable, your nervous system becomes more reactive, your heart becomes more vulnerable to fluctuations. Now add another hidden factor: undiagnosed sleep apnea. Your airway collapses briefly, oxygen drops, your brain releases adrenaline, your blood pressure surges suddenly. This may repeat dozens of times. And finally, add mild, untreated hypertension, slightly elevated blood pressure that seems harmless during the day but becomes far more dangerous when combined with every other nighttime stress. Each factor alone may seem manageable.
A heavy meal alone is not fatal. Alcohol alone is not always fatal. Dehydration alone is not always fatal. Sleep apnea alone does not always cause immediate catastrophe, but together they create a compounding effect. Your blood is thicker, your oxygen is lower, your blood pressure is less stable, your arteries are under greater stress, your heart is working harder in a system designed for rest. This is how a silent cascade forms, layer by layer, hour by hour, until one final trigger, a pressure surge, a clot, or a plaque rupture, turns a normal night into a life-ending event before morning arrives.
The most tragic part of these nighttime events is that the body often gives warning signs, but they are quiet, subtle, easy to dismiss. Many people experience these symptoms for years without realizing they may be signals of serious cardiovascular strain during sleep. One of the most common warning signs is loud, chronic snoring. Snoring is not just a sound, it is a sign that air is struggling to move through a partially narrowed airway. Each vibration reflects resistance, instability, and stress in your breathing system. In many cases, loud snoring is one of the earliest signs of sleep apnea, even when the person feels unaware of breathing interruptions. Another major warning sign is waking suddenly around 3 a.m. with your heart pounding. Many people describe this as a sudden jolt. Their heart is racing. They may feel alert, anxious, or slightly breathless. This is often the result of an adrenaline surge triggered by a temporary oxygen drop. Your brain activates an emergency response to restore breathing and circulation, even if you don't consciously remember why. Morning headaches are another overlooked signal. When oxygen levels drop repeatedly overnight, blood vessels in the brain expand and contract abnormally. This creates pressure changes that can lead to dull, persistent headaches upon waking. Many people blame stress or dehydration, never realizing the true cause may have occurred hours earlier during sleep. A dry mouth upon waking is also significant. This often indicates mouth breathing during the night, which commonly occurs when the airway is partially obstructed. Mouth breathing reduces oxygen efficiency and reflects instability in normal breathing patterns. Night sweats are another warning sign people ignore. Sudden sweating during sleep is often linked to nervous system activation. It can occur when your body releases stress hormones like adrenaline in response to oxygen deprivation or sudden blood pressure changes. Frequent nighttime urination is another signal that surprises many people. When oxygen drops and the heart experiences stress, your body releases hormones that increase urine production. This is why many individuals with nighttime cardiovascular strain find themselves waking repeatedly to use the bathroom, even if they drank very little fluid before bed. And finally, one of the most important warning signs is feeling tired despite spending 7 or 8 hours in bed. You may believe you slept long enough, but if your sleep was unstable, interrupted by oxygen drops, pressure surges, and nervous system activation, your body never truly entered deep restorative recovery. You wake up exhausted, even though you were in bed all night. These symptoms are often dismissed as normal aging, but they are not normal. They are signals that your heart, your brain, and your oxygen system may be under silent strain during the most vulnerable hours of the night. Most people believe their blood pressure is stable at night. They assume that when the body rests, blood pressure naturally falls. And in healthy individuals, that is exactly what should happen. This normal drop is called the dipping pattern. During sleep, blood pressure typically falls by 10 to 20%, allowing the heart and blood vessels to recover from the stress of the day. But for millions of people, this protective drop never happens. These individuals are known as non-dippers. In non-dippers, blood pressure stays elevated throughout the night. The cardiovascular system never gets the chance to rest. The arteries remain under constant tension. The heart continues working harder than it should during a period designed for recovery. Even more dangerous, in some people, blood pressure doesn't just stay high, it rises. This is called the reverse dipping pattern. Instead of recovering during sleep, the cardiovascular system becomes more strained. Pressure inside the arteries increases during the exact hours when blood is thicker, oxygen levels may be lower, and clotting risk is already elevated. This creates a perfect environment for a silent cardiovascular event. And the most alarming part is this: most people never know it's happening. Standard blood pressure measurements are taken during the day. You sit in a clinic, your arm is checked once, maybe twice. If the numbers look acceptable, you were told everything is fine. But these daytime readings cannot see what happens at 2 a.m. They cannot see what happens at 3 a.m. They cannot see what happens at 4 a.m. when your body enters its most vulnerable transition. According to the American Heart Association, nighttime blood pressure is actually a stronger predictor of stroke and heart attack risk than daytime readings. This is because nighttime pressure reflects the true resting stress on your arteries without the masking effects of movement, activity, or temporary relaxation. When blood pressure remains elevated all night, the inner lining of arteries experiences continuous mechanical stress. This weakens fragile plaques, it increases the risk of rupture, it accelerates clot formation. And because this happens silently, without symptoms, the first visible sign may be the event itself: a stroke, a heart attack, or a person who simply never wakes up. The danger was present for years, but no one was checking during the hours that mattered most. Many people reach for a nightcap, thinking a small drink will help them fall asleep faster. And at first, it seems to work. Alcohol has a sedative effect. It calms the nervous system and helps you drift off. But this is only the beginning of the problem. A few hours later, as your body begins to metabolize the alcohol, a rebound effect kicks in. Your nervous system suddenly becomes more active, heart rate increases, blood pressure surges in the middle of the night. Your heart may beat irregularly, and the risk of dangerous arrhythmias, especially atrial fibrillation, rises. Meanwhile, alcohol accelerates dehydration. Your blood becomes thicker, your heart works harder to pump it through your vessels, oxygen delivery slows. The combination of thicker blood, higher pressure, and nervous system instability creates a perfect storm for cardiovascular events while you're asleep. What seemed like a harmless nightcap can quietly turn into a dangerous trigger, silently increasing your risk of heart attack, stroke, or sudden nighttime death, all while you think you're getting a restful sleep.
Another hidden danger that most people never consider happens every time we eat a late, heavy dinner, especially one high in salt. When you eat late at night, your body's metabolism is already winding down. Insulin sensitivity, your cell's ability to absorb and process blood sugar, naturally decreases at night. That means the sugar from your meal lingers in your bloodstream longer than it would during the day. Elevated blood sugar isn't just a concern for diabetes. It triggers inflammation throughout the body, subtly stressing your arteries and heart while you sleep. On top of that, high sodium intake compounds the problem. Sodium draws water into your bloodstream, increasing fluid volume and causing your body to retain water. This raises blood pressure. Even if your arteries and heart would normally handle a quiet night, the extra fluid creates additional mechanical stress on fragile plaques and thickened blood. When these effects combine, lingering blood sugar, inflammation, and fluid retention, the result is a more vulnerable cardiovascular system by the early morning hours. Blood pressure spikes higher than normal, heart rate may rise, and the risk of a clot or plaque rupture increases, often without you feeling any symptoms at all. This is why late-night meals, especially heavy or salty ones, aren't just a digestive concern. They quietly set the stage for the same dangerous cascade that can turn a normal night into a life-threatening event. Your body may appear to rest, but internally it is under strain, struggling to cope with elevated sugar, fluid, and pressure while you sleep. Another factor people rarely think about is the temperature of the bedroom. It seems harmless, even cozy, but warmth at night can silently increase cardiovascular risk. For your body to enter the deepest, most restorative stages of sleep, especially slow-wave sleep, your core temperature needs to drop slightly. This cooling signals your brain that it's time to slow down, allowing heart rate and blood pressure to naturally decrease. It's a critical part of nightly recovery. When your bedroom is too warm, your body struggles to achieve that temperature dip. Your heart rate stays elevated. Your blood pressure doesn't fall as it should. The nervous system remains slightly on alert, making your cardiovascular system work harder during a period that should be full of rest. This disruption also affects sleep quality. Less slow-wave sleep means your body misses out on the restorative processes that repair tissues, clear metabolic waste from the brain, and regulate hormones, including stress hormones like cortisol, that directly influence blood pressure. Over time, chronic exposure to warm sleeping environments can subtly increase strain on the heart and arteries, especially combined with other nighttime stressors like alcohol, heavy meals, or mild hypertension. In short, what feels like comfort, a cozy, warm bedroom, may quietly keep your cardiovascular system in a heightened state, increasing the risk of nighttime heart events, blood pressure spikes, and poor oxygen delivery. Even your most peaceful night can become a hidden battle for your heart if your environment doesn't support proper physiological rest. A modern danger that almost everyone overlooks is keeping your phone on the nightstand. It seems harmless, even convenient, but it can quietly undermine the very processes that protect your heart and brain during sleep. The first issue comes from blue light. Phone screens emit high-energy blue wavelengths that strongly suppress melatonin, the hormone responsible for signaling to your body that it's time to rest. When melatonin production is reduced, your natural circadian rhythm is disrupted. Without proper melatonin, your nervous system stays slightly more alert than it should, and your cardiovascular system doesn't get the full protective rest mode it relies on at night. This disruption has direct consequences on blood pressure. Normally, blood pressure dips during sleep by about 10 to 20%, but with reduced melatonin, that nighttime dip is blunted. Your heart continues to pump harder, your arteries remain under constant tension. The very time when your cardiovascular system should be resting becomes a period of ongoing strain. The problem doesn't stop there. Phones also trigger micro-arousals, tiny awakenings caused by notifications, vibrations, or even the subconscious urge to check messages. Each micro-arousal jolts your nervous system slightly awake. Cortisol, your body's stress hormone, spikes in response. These repeated small stress responses may seem insignificant individually, but over the course of the night they accumulate. This fragmented sleep reduces the time spent in slow-wave deep sleep, which is crucial for cardiovascular recovery. During deep sleep, your heart rate slows, your vessels relax, and your body repairs cellular damage. Interrupt that stage repeatedly, and the heart and arteries never fully recover overnight. The repeated cortisol spikes, combined with reduced melatonin and fragmented sleep, create a perfect storm. Blood pressure stays higher than normal, heart rate fluctuates unexpectedly, stress hormones surge, vulnerable plaques in arteries are subjected to repeated mechanical strain, oxygen delivery becomes less consistent. Even if you think you're sleeping through the night, your body is experiencing a series of mini cardiovascular crises. Each interruption may only last seconds, but cumulatively they put your heart and brain under a level of stress that can quietly increase the risk of heart attack, stroke, or other nighttime events. In other words, your phone on the nightstand isn't just a distraction, it's a silent enemy of deep, restorative sleep and a hidden contributor to cardiovascular strain while you rest. The convenience comes at a cost your body pays, often without you ever noticing.
Now let's talk about who is truly at highest risk of these silent nighttime cardiovascular events, the people most vulnerable after the age of 50. Understanding these risk factors is essential because the cascade we've been describing doesn't affect everyone equally. Certain conditions and life stages amplify the dangers dramatically. First, there's hypertension. High blood pressure. Even mild elevations that seem manageable during the day can become dangerous at night. As we discussed earlier, some people are non-dippers or even reverse dippers, meaning their blood pressure doesn't drop or rises while they sleep. High blood pressure puts constant strain on the arteries and heart. Over decades, it can weaken arterial walls, making plaques more likely to rupture. Even a single spike during the early morning hours can trigger a heart attack or stroke in someone with hypertension. Next is diabetes. Elevated blood sugar over time damages the lining of blood vessels, promotes inflammation, and increases the thickness of blood. Diabetic patients often have a condition called autonomic neuropathy, which can blunt the normal heart rate and blood pressure fluctuations at night. Combined with sleep-related oxygen drops or other stressors, this creates a situation where the cardiovascular system is less able to compensate for sudden surges, increasing the risk of silent events. Kidney disease is another major factor. Healthy kidneys help regulate blood pressure, fluid balance, and electrolytes. When kidney function is impaired, fluid retention worsens, blood pressure can rise overnight, and toxins may accumulate that further stress the heart. The combination of thickened blood, higher pressure, and impaired regulation makes the early morning hours particularly dangerous for those with kidney disease. Then there's high cholesterol. Plaque buildup in arteries is primarily caused by elevated LDL cholesterol and low HDL cholesterol. Years of high cholesterol silently create unstable plaques in the arteries. These plaques may never cause daytime symptoms, but are highly vulnerable to rupture during the early morning surge of blood pressure or adrenaline. Family history of stroke or heart attack is a risk factor that cannot be ignored. Genetics influence artery elasticity, plaque stability, blood clotting tendencies, and even how the body responds to stress hormones. If a parent, sibling, or close relative had a heart attack or stroke, your risk, especially during sleep, is significantly higher. Postmenopausal women face a unique risk. Before menopause, estrogen helps protect the cardiovascular system by improving arterial flexibility and blood flow. After menopause, estrogen levels drop, and women lose this natural protection. Blood pressure tends to rise, cholesterol profiles worsen, and arterial stiffness increases. For postmenopausal women, nighttime cardiovascular strain becomes more dangerous, and silent risks like oxygen drops or pressure spikes carry even greater consequences. Finally, anyone with untreated snoring or suspected sleep apnea is at increased risk. We've already discussed how airway collapse, repeated oxygen drops, and adrenaline surges put enormous strain on the heart and blood vessels. Even mild, untreated snoring can indicate partial obstruction that silently stresses your cardiovascular system every night. Over years, these repeated insults accumulate, greatly increasing the likelihood of heart attacks, strokes, or sudden nighttime death. In short, after 50, the people most at risk are those with underlying cardiovascular or metabolic conditions, a genetic predisposition, or sleep-related breathing problems. Combine any of these with lifestyle factors, late meals, alcohol, warm rooms, phone use, and the night transforms from a period of restorative rest into a silent battlefield. Understanding your personal risk is the first step to protecting yourself, because for these vulnerable individuals, a single night can be the difference between life and death. Here's the good news. While all of this sounds scary, there are practical steps you can take starting tonight to dramatically reduce your risk. Small changes can have a huge impact because the body responds quickly when given the right conditions. First, remove your phone from the bedroom. That means no notifications, no blue light, no temptation to check messages. If you must use it as an alarm, place it across the room. Better yet, stop all screens at least 60 minutes before bed. This allows melatonin levels to rise naturally, stabilizing your circadian rhythm and helping your blood pressure and heart rate dip appropriately overnight. Hydration is key. Drink water consistently throughout the day, but avoid excessive fluids right before bed. Proper hydration keeps your blood at the right viscosity, reducing clot risk and easing the workload on your heart while you sleep.
Next, rethink your dinner timing. Aim for a light meal at least 3 hours before bedtime. Avoid heavy, high-sodium foods that elevate blood sugar and increase fluid retention. A lighter meal gives your body time to digest and reduces nighttime stress on the cardiovascular system. Limit alcohol, particularly close to bedtime. Remember the rebound effect. Initial sedation is followed by nervous system activation, blood pressure spikes, and heart rhythm instability. If you do drink, try to finish several hours before sleep and moderate your intake. Control your bedroom environment. Keep the room cool, ideally between 60 and 67 degrees Fahrenheit, 15 to 19 degrees Celsius. A cooler room helps your core temperature drop, promotes deep, slow-wave sleep, lowers heart rate, and allows blood pressure to fall naturally. If you snore heavily or suspect sleep apnea, get evaluated by a doctor. Treatment, whether a CPAP device, oral appliance, or lifestyle intervention, can prevent repeated oxygen drops and adrenaline surges that silently stress your heart and brain every night. Finally, ask your doctor about nighttime blood pressure monitoring. Home or ambulatory monitors can detect non-dipping patterns, reverse dipping, or dangerous nocturnal spikes that routine office readings miss. Knowing your true nighttime blood pressure allows your physician to personalize interventions, medications, and lifestyle adjustments to protect you when you are most vulnerable. These steps may seem simple, but they address the exact physiological mechanisms that make nights dangerous for so many adults over 50. Start tonight, and over time, you can transform your sleep from a period of hidden risk into a period of genuine restoration, giving your heart, brain, and body the protection they deserve.
It's natural to feel a little alarmed after hearing all of this, but here's the reassurance. Your body is remarkably responsive. It's not helpless, and it doesn't take months or years to start seeing benefits. Small, consistent changes can create immediate positive effects. If you adjust your sleep environment, improve hydration, and moderate late-night meals or alcohol, your blood pressure can begin stabilizing within just a few weeks. Your nights will feel calmer, your heart and arteries will experience less stress, and the early morning risk window becomes much safer. Sleep quality improves even faster. Within days, many people notice deeper, more restorative sleep, fewer awakenings, and more energy in the morning. Each positive adjustment compounds on the last, gradually transforming your nights from a period of hidden strain into genuine recovery time for your heart, brain, and overall health. The key is consistency. These are not dramatic, overwhelming changes. They are simple, practical steps, yet their cumulative effect is profound. Night by night, small interventions protect your heart, improve circulation, reduce stress hormones, and support oxygen delivery to vital organs. With awareness and action, the silent dangers of the night can be dramatically reduced, giving you peace of mind and real physiological protection, all starting tonight. Here's the reality to take with you. Your heart faces its greatest stress between 4 and 10 a.m., the very hours when most people think they are safest, quietly sleeping. What happens during that time is rarely random. Heart attacks, strokes, and other cardiovascular events are usually the result of predictable physiological sequences, cascades of stress, blood pressure spikes, oxygen dips, and clotting events that quietly build while you rest. The good news is that you are not powerless. The night before, your habits, your environment, your sleep quality largely determines how your body handles this vulnerable window. By making targeted, consistent changes, you can interrupt this dangerous sequence. Every action matters. Hydrating properly, cooling your room, adjusting meal and alcohol timing, reducing screen exposure, and addressing sleep apnea or high nighttime blood pressure. Each of these steps interrupts the chain reaction that could otherwise escalate while you sleep. You have the ability to protect your heart, your brain, and your life, starting tonight. It's not luck, it's preparation, awareness, and simple science-backed interventions that give your body the advantage during its most vulnerable hours.
Before we wrap up, don't forget to hit that subscribe button and tap the notification bell. Doing this ensures you never miss crucial health tips that could literally protect your heart and your life. If you found this video valuable, like and comment below. Share which change you're going to implement first tonight. Your action not only helps you, but can also alert someone you care about to these hidden nighttime risks. Remember, every small step counts, and staying informed is your first line of defense. Subscribe now and join our community committed to safer, healthier nights.